It is such a pleasure to meet you and kind of learn about the work that you do. So, how about you start by introducing yourself, who you are, and what you do?
Sure. So my name is Adimika Arthur. I run an organization called HealthTech for Medicaid. We bring payers, providers, policymakers, and entrepreneurs together to scale and innovate in the Medicaid space. I basically am a consensus builder, and we call ourselves a market-based enabler to help bridge technology to the patients that need it the most.
Sure. So, when we're talking about the Medicaid population, what has been some of the disadvantages that you see, or what are some of the things that you're hoping to solve for?
Sure. So first, stepping back, the Medicaid population is a very big population. It's 75 million people in this country. It's 50% of the births in this country, 48% of the nursing home visits that are paid for in this country. So it's a huge population, and it's all over geographically. The Medicaid program, because it's a federal and state partnership, you do get different rules for Medicaid in each state. And so I think that's the first step in kind of making some rationalization around how technology can play in that space, is really understanding where the pain points are from the entrepreneurial side, what do the providers need, what are the payers finding as populations or subpopulations that they're really interested in providing better service and care to, and how can we work in a policy framework to better advocate and better provide solutions to bridge technology to the patients that need it the most.
In terms of where you're hoping the shift will happen, the trajectory of healthcare and healthcare delivery for quality health for all people, like what is the biggest goal of this project?
Sure. So, to me, there should never need to be a HealthTech for Medicaid. There's a need for HealthTech for Medicaid because we've created an entire, in some field, right, of health technology, but we haven't necessarily created products that serve everyone. We've created products that typically serve employer-based markets and individuals who have the discretionary income to pay to play, right? And so I guess if we would have started this with a different ethical framework or had health equity as a part of our kind of construct, then we wouldn't have to find something like this that as an organization to be here, because every health technologist, every innovator would basically want to solve health for everyone. And I recognize there's a productive tension there between business, right? Like it's a business. But I do believe we have an ethical imperative in health to make sure that all of our solutions are easily accessible and adequately accessible to everyone.
Well, what advice would you have for innovators or entrepreneurs that are building technology? How do you incorporate those voices of people that are traditionally marginalized or underrepresented?
I'll admit, I think that entrepreneurs are in a tough spot, right? Because you're trying to build a solution. You're a startup by nature, so you often have very limited funds, and now you're being asked pressures in the market to work with folks to develop something specifically. What I would say is oftentimes when we build from the point of inclusion, like building from those individuals who are vulnerable and don't have as much, it often serves absolutely everyone, right? And I think that that's the reason why many of our policies in this country are the way that they are, is that in order for, you think about, I won't use a charged topic like vaccinations in schools, but there are many examples of us using policy as a way to make sure that we're including everyone, and it better serves absolutely all people. So I recognize that it's tough to be an entrepreneur, and one of the things I would say is if you're interested in a specific area of healthcare, you want to make sure that you have a representative sample of those individuals who have that disease state, or if you're a transportation solution, you should understand how do people actually get to their appointments and not make assumptions. And that's by working with the community, which I understand is challenging and complex and expensive, but ultimately it's the best way to move ahead. And that's the reason why HealthTech for Medicaid really feels like we need to bring all the stakeholders together, because it's really not on the responsibility only of the entrepreneur. It's really, the payers need to be able to articulate what it is that they will pay for and what it is that they need. And the providers need to be able to be willing to implement it, right? So it takes ingenuity from an entrepreneur to go into a provider space to make sure that patients have access to something, and then payers paying for it, and then ultimately that could also be a plethora of payers, right? It could be a state procurement payer, it could be an insurance company, it could be a private equity firm or a VC. So this cycle only works really well when we're working together, right? If we realize in this country we really have terrible outcomes and we'd like to see some innovative solutions in an area, we need to basically be able to define like what that area is. Like maternal child health. We have incredible maternal deaths. And so how do we then solve that problem? And if you bring all of these disparate thoughts in the room, and then really work within the community, we can easily solve solutions. Because in many cases, the community has the answers. They just don't have the ability to vocalize those answers, create their own digital health solutions or digital therapeutic solutions or technological solutions, and then have them walk through the process of, going from scalability to adoption.
Do you mind getting into an ideal situation of all the stakeholders, the payers, the providers, the entrepreneurs, and even the policymakers? How do we design a future of healthcare that it is equitable and that is fair to all people?
Yeah, I mean, obviously we're talking about the panacea here, right? Like there's no one place that does this well, but I think there are incredible models and examples. I'll use North Carolina as a great example. Mandy Cohen, who's the state Medicaid director there, and really interested in thinking about health from a holistic perspective. She believes every North Carolinian should have access to good health care. And that is where it really starts. So at the policy level, making sure that everyone has a broad perspective. She also has been working really closely with innovators like Unite Us and others who are creating solutions that help them meet their greatest need. How do we create social engagement mobilization strategies that help us understand the needs of our entire state? Right? And then how can we work with all of our payers in the state to be able to engage into this methodology? And I think acknowledging that we're going to learn as we go along. Health is not a science that, we just wave a magic wand and we know all the answers. We learn as we go along. And so acknowledging where we've made missteps, where we could do better, how we could do better is a part of the journey.
I can see that you're clearly passionate about this topic. So what keeps you passionate? What keeps you driven?
I have a public health background. I'm an epidemiologist by training and spent the last 15 years being a hospital administrator. So I have bruises still, I think, from, beating my head up against a wall, really trying to solve problems for mainly underserved populations and vulnerable populations. I think the thing that gets me up every single day is recognizing that if not now, when? Like, if we don't make a difference today, we're just going to further divide technology from populations who are just as deserving as anyone else to have quality and duration of life, right? And so I feel like I'm on the backs of 75 million people who are counting on us to include them in many of this. These are my family members, these are my friends, these are my neighbors, right? These are the people I go to the grocery store with. And so for me, it's from a community framework, and it's also a program that I'm not exempt from. Who's to say that I could lose my job and the next thing I know, I'm on a government-related program. So I often just think about it as it's just good community. It's community good to make sure that we are all healthy. It's what helps our country be productive and to have us be good citizens. So the things that drive me are continuing this drumbeat of making sure that everyone, when people think of health, they think not only of certain populations, but they think of everyone deserves health as a right.
Thank you so very much for your time.